Hello, I'm JoAnn Van Tassel, and welcome to another program in Information in the Public Interest. Today I have with me as guests State Senator Jim Marleau from this Orion area, and David Roy, who is the owner of Lake Michigan Mailers, Inc., and is immediate past chairman of the Board of Directors of the Small Business Association of Michigan. And we're going to be looking at the Medicaid program here in the state of Michigan. Recently, the legislature approved a new law that increases the number of people eligible for Medicaid, with a proviso that the federal government for the first 2 years picks up 100% of the cost of the program, and then thereafter pays 95% the third year, 90% thereafter. And people say, well, what good does that do to expand the Medicaid program? Well, there are some other provisions in there to make this program more cost effective than it's been in the past. Among the provisions are that each of the enrollees must have a primary care physician that they go to first before they seek care in the emergency room of a local hospital. It also requires that the Department of Community Health, working with the healthcare providers and the health insurance companies, develop procedures and practices that allow for the more efficient use of emergency rooms, with the idea being to cut down on the number of people who are using emergency rooms for non-emergency purposes. So with that general background, let me make one more thing. The old Medicaid program said that you had to be at or below 100% of the federal poverty guidelines. And for a single person, that's $11,490. And for a family of four, that's $23,530. With this new program, we go to 133% of the federal poverty guidelines. So for a single person earning $15,000 or $280 or less, or for a family of four, $31,320, those are the people who are now eligible for the Medicaid program. And another important cost-saving element of this program is that they are eligible to use telemedicine. In other words, they can use a telephone and call up a doctor who is licensed here in the state of Michigan and certified as a provider of this type of service, and get many of their health questions answered over the phone without having to go to the doctor's office or to the emergency room. So with that background, Senator Marleau, I understand you were instrumental in helping get this legislation through up in Lansing.
There were three major reforms that I felt that had to be there. First of all, the bill 4719-9, which means that there was 9 revisions, is a considerable amount of revisions on a single bill. And that's because we kept working on it, spent all of last summer, June, July, and August, 3 days a week, we were in Lansing, carving this out. A couple of the main reforms that I was mostly in, first of all, there's a premise. And the premise that we are trying to eliminate is that those without insurance seem to use the emergency room as their primary care physician, which is the most costly way to do business. So what this whole package did is to try and take that patient, give them a card, and run them through the system, through a primary care physician, through a clinic, and allow them to have medical records that they could work with. And so by doing that, the cost becomes less expensive, and the savings goes to both the hospital and those that buy the insurance. So that is the premise. This is the cost saving. The savings is done through not having to run every single test there is because they have it in your file. An emergency room does not keep a file. So that's part of it. And every single person a single person should save $400 a year. A family will save $1,000 a year because of the hospitals not having to write off, non-payment of the services, which then means they go back to our insurance companies and raise our rates to cover the cost. There is no free lunch. And that's the most important thing that we got in there. We also got transparency in there. Residents should receive relief. We talked about the situation of the 90%, if we can bank that money and use that money, we should be able to pay for all of this until 2030 by banking 50% of the savings. And so that's the other part of this. So there's a lot of math. I like to think of this, remember when we were in grade school and we had the math problem that said if a car was going 70 miles an hour going west to Chicago, we stopped twice to eat lunch, once to eat lunch, once to eat dinner, and once for gas, what time would we get in Chicago? Well, this is the same thing. And it's very, very involved, and there's a lot of steps, and there's a lot of checks and balances. The director of insurance is involved, the director of community health is involved with reports that are going to be coming from the hospital to make sure that we're keeping all of these costs under control. And with that, I'll just go quiet for a second. And see
okay, and Mr. Roy, from the business person's point of view, why is this legislation important to you and members of your association?
Well, from the perspective of the Small Business Association of Michigan, or SBAM, we've looked at the Affordable Care Act as not a positive thing. In fact, we've been fighting and continue to fight significant aspects of the Affordable Care Act since it was enacted. But the Affordable Care Act did get one thing right, and what it stated was that the costs of the uninsured are being borne by those who have health insurance. And in Michigan, a lot of that health insurance is provided by small business. So, as the Senator mentioned, when people without insurance seek help at the emergency room, it's the most expensive avenue into our healthcare system. And that cost has to be absorbed someplace. While the hospitals often take a large sum of that themselves, they're shifting those costs to those who actually have insurance, driving up the cost of services, driving up the cost of testing, and those additional costs find their way into the rates that small business owners are paying on their premiums and those who are providing it. And we're starting to see, and we have seen for the last 2 years, a decline in the number of small businesses that are offering insurance. To give you some perspective, if you look at the numbers from 2012, 42% of small businesses who had less than 50 employees offered insurance to their employees. That number is now, in 2013, that number has slid down to 37%. We expect that number to slide even further at the end of this year when the employer mandate becomes effective. So to look at creating a better surrounding for Medicaid makes good business sense. And we also look at it as a perspective, from the perspective of making Michigan more competitive within our region. We are, for lack of a better term, competing with Indiana, Michigan, or Indiana, Ohio, Wisconsin, Illinois. These states have a lot to offer, as we have a lot to offer here in Michigan. But when we can set up a structure for Medicaid that allows us to keep the costs down, and it becomes less expensive for an employer to hire someone here in Michigan than compared to Indiana, Ohio, or Illinois, or Wisconsin, that's good for Michigan, and it's good for the businesses that are here.
I'd like to go back to this uncompensated cost for people who seek emergency room services without having insurance. So to make sure I understand it, you talked about then we've got to pay for tests and we've got to pay for other things. So let me see if I understand. So let's say that a basic routine test that might be conducted either at a doctor's office or in the hospital, they go to the emergency room, and So ordinarily, the cost would be about $100. But because we got to cover all these uninsured people, then the hospital charges $120 or $125 for that cost to those people who have health insurance. And so the theory is, and I think they've seen some of this in practice, by eliminating the uninsured from going to the emergency room and going to having Medicaid that will cover these costs and going to a primary care physician, then the cost will get back more to what's a realistic cost rather than an inflated cost to cover those without health insurance.
That's correct. And also I want to point out, these new patients that will be receiving the Medicaid between the 100 and the 133 will be paying a copay. And the only ones that won't be paying a copay is those that have chronic diseases such as diabetes and heart conditions and those that are considered in the medical field as critical. And the situation, I fought for that because I did not want to have a single patient use the excuse that they couldn't afford to pay the copay, so that's why they didn't go to the doctor. And I have these bad visions that, you know, if a diabetic person doesn't get on the regular treatment, you know, bad things happen, you know, limbs are removed, and that costs the taxpayers a lot more money than a few dollars on the copay side. And there's a lot of people that didn't want anybody to have, they wanted everyone to have, I should say, skin in the game. But there's a few isolated incidences that I felt that it was more important not to set a barrier that somebody could use an excuse. Now I know everybody's got a cell phone and they could find the money, but the problem is they also use it for excuses. So I didn't want that to be an excuse. But these are very, very important things that we need to be able to say that these people are, we tried to eliminate as many barriers as we possibly could think of, because 3 generations they've been going to the emergency room. These habits are going to be hard to change, you know, and it's not going to be the simplest thing to do, but I think it can be done, and I think that the medical field is out there, the hospitals and the doctor's offices are basically understand that this is the direction that we have to go in, because quite frankly, our healthcare costs are out of control. It's the largest expense that we have in our state budget. Our community health budget is $16 billion. Of the $16 billion, that's with a B, not an M, the $13 billion is Medicaid at the current time. Yeah. And that's the reason why we have to get this under control. And so hopefully if we can start here and start a generation and move forward and be able to, and part of this is, it's defensive medicine. When you go into the emergency room, you know, everybody's fearful of a lawsuit. So they run every test that's possible, so if anything, you know, they miss or whatever, they can say, well, we ran it on the patient, we had, you know, and this, that, and the other thing. So that's the reason why they do it, and so it's a different situation. And we just have to basically move forward into, as I like to say, the 21st century and get these people. And one of the important things that David was talking about is, and I agree with him, is when I go to Lansing, one of my most important things that I am concentrating on and focusing on is jobs. And government does not create jobs. I don't go there and sit, how can I create a job? But I can tell you that we can create a job-friendly environment in the state of Michigan, and the Healthy Michigan job atmosphere makes it friendly, and businesses will come to Michigan. They'll come from other states. Our own businesses will create jobs, and foreign countries, which we have a lot of in this part of Oakland County, will come here also, because if you have a healthy workforce, you get more productivity, you have less sick days, and it's all of those things. So it's, again, it's a very, very in-depth math problem. We're competing, as David said, here in the Great Lakes states with the other states that are doing this, and we have to be competitive.
Okay. Another thing I noticed in the legislation was that each of these enrollees in the Medicaid program has to have an annual health risk assessment. which means they're checked for what are your eating habits? Is this contributing to a pre-diabetic condition, and what changes could you make? Are you a smoker? Here's a program that we recommend to help you stop smoking. Not that we mandate it, but try to educate these people on how to live healthier, eat healthier, and the healthier they are, the less demand then there is for healthcare services.
Well, you're right, and the senator mentioned having skin in the game. That's a critical component of these reforms. To be able to create a culture that says to the recipient, this is not simply a handout. You have an obligation to be involved and engaged in your own health care, and whether it's the use of an HSA account and setting aside money for medical expenses.
An HSA.
Sorry, health savings account.
Okay, thank you.
Tax-free account where money can be set aside for approved medical expenses. And so the program reforms that were put into law established that HSAs are required. You mentioned the annual health review. We're trying to not only move people out of the ER to a less expensive pathway to medicine, but we're trying to create a culture where people are engaged at the personal level for their health and the health of their family.
One of the other things, as you mentioned, how you have to go through the assessment. Let's just assume that somebody has, smokes. It's determined in that assessment at the beginning. Now, if they work towards getting off of the habit, they receive additional rewards into their SHA health savings account in the form of extra dollars that they can use towards copays. So there is a reward, and it's up to them, and it's not mandated. But if you want it, it's there.
So there's an incentive to live healthier.
Yes, there is. And the key to that is you'll live longer and cost less. So it's all connected together. And I firmly believe, David mentioned the hand up, it's not a handout. The problem is that there's waivers involved in this. The state has received one waiver. We have another big waiver coming up next year from the state on some of these reforms. And the resident is heavily involved in this. The insurance companies are involved in this. Premiums and copays are involved in this third waiver. And the major part of this is if the waiver does not come from the federal government on the way that we put these reforms together in the state of Michigan, then the entire program ceases at that moment in time. It's all based on the premise that these steps will be followed and we will get to that point. And it's very important. We received the first waiver, and so now we're moving forward. Part of these reforms, we will have a committee. I'm on the committee, and we will be working 9 months of this year to be able to present this in November on how we feel some of these reforms need to be connected together and include the patient in these, the doctor in these, the insurance company and the health department. We're all going to work reporting together. One of the other things, part of these reforms is that I believe a patient should know what they're getting. If you're going in for selective surgery, let's say a hip, a knee, or something, you should be able to go onto a state website and be able to see what these costs are at each particular hospital. And they're not all the same. And then we will be able to have quality ratings in there also. So it's basically, as a patient, you're going to be an informed patient. You're not just going to wake up 6 months later when the bill comes in the mail and say, my gosh, where did all these costs come from?
Okay, is this something only available to the Medicaid?
No, it's going to start with that, but we're going to try and get this up and running. I have a bill out there that's to do it across the board, but it is in the Medicaid package. So we're working dually with this.
So that people who need surgery or a certain procedure can, if you will, go online and shop for the nearest, most price competitive provider.
Yeah, and in some cases, our own physicians are at multiple hospitals, so you can compare the two.
Anytime a consumer is informed, they're able to make better decisions, and they're able to make decisions based on any number of factors that are unique to them. But the key is that they have to be informed.
Yes. I had the pleasure of one of our residents here in Orion at his business, and the gentleman wasn't limping any longer, and I said, wow, things are going well. And he says, yeah, but I got the bill on Saturday, and he says, I was really shocked. And I said, what do you mean? And he said, it was a lot more than I thought. So this is where my passion for this has come involved, because someone right here on Lake Orion brought this to my attention. And it's just one of those things. It's almost like, you know, we don't walk into a car dealership and say, you know, what do you think I need on a car, and just drive it up front and I'll sign for it. You know, we go there, we talk about what our needs are, and we check out the costs, and it's the same thing. We need to get more involved in our own health care. Those of us that sit on our wallets, we're sitting on that card, and we need to get involved and ask more questions, and that's what this is all about.
Okay, I also noticed in the legislation that it puts some responsibilities on the Department of Community Health, and one of those items is for them to conduct a symposium with the healthcare providers and the insurance, looking at what are some best practices that can be used. Could you elaborate on that a little?
We're in the process of setting that. We received a federal grant to allow that to start. I anticipate that we're going to be bringing that together in March, and it's basically exactly what you said. We're going to bring the Department of Community Health. We're going to bring the insurance department together, and we're going to work together to try and keep these costs down. The hospitals are going to be reporting what the costs are, and we're going to bring this all together. And if we don't work on this together, if one piece of this, in other words, hypothetically, let's say that the hospital, now that they don't have this as an emergency room, they do not have to charge those with a card higher prices, okay? But if the insurance company don't turn around and lower the cost, then we're not saving anything.
In other words, lower their rates.
Right.
Yeah.
Lower the rates. So this is where we have to have the check and balance, and that's why we're putting all of this together. And it's the key to the whole thing is the checks and balances and the transparency that we need to have, and make sure that we're getting the results that we anticipate.
Okay, changing the subject slightly. In this area, I'm sure many people are familiar with Dr. Fada, and who has been charged in a number of counts of fraud, not only in Medicaid but also the Medicare program. And I see that this law now has incentives for people to detect and report fraud and poor practices. How does that impact small business?
Well, I think this is the issue of Medicaid expansion, particularly in mainstream media, tends to be a checkbox on a subject matter. But as the senator points out, it's a very complex issue. And the reforms that we put into place with Healthy Michigan are really a comprehensive approach. So when you talk about fraud or identifying fraud, anything that adds to that cost structure for our health care in this state ultimately ends up getting paid for by people who have insurance. And whether that's a single business person or a person with 50 or more employees or a large corporation who's even self-insured, all those costs rest on the insurance premium, because everything's getting thrown in, all the costs are getting thrown into that bucket. So when you talk about fraud detection and reporting, those are the same kind of tools that any business person would use to keep their costs down. And they may not be immediate. It's really a long view approach to a problem, but it's a consistent approach to a problem. And it matches very well with the other reforms that we've been able to make here in the state that help attract and keep businesses right here in the state.
There are computer programs that I've had the pleasure of sitting down and companies from out of state have come here with their software. We're in the process of reviewing that, and these software detect this much sooner than the software that we're using at the current time. And so that will be part of this as we move forward, that we will be putting these as part of the checks and balances.
Hopefully it's not the ones that...
No, it's not. It's
not the ones that developed the federal program.
No, not at all. But they are using them in other states, and it's much quicker that you can detect a pattern that's not normal for other physicians in the same like practice.
Okay, and I think it's important to note, because when this law was under discussion last year and up for passage, a lot of people were all against it. Oh no, you know, it's going to cost us more tax money, and it's going to cost... I think the important thing to note is for the Michigan person is this is an attempt to drive down costs for health care and benefit not only those who, because of their income level, are on a Medicaid program, but also provide for those who've got good paying jobs to maybe have more affordable health care, either that they provide themselves or that is implied through their employer.
It's very important, and it's very obvious. You don't have to go out into one of David's small business clients, but you can just, you know, I stop quite regularly at McDonald's for a cup of coffee or something, you know, sandwich, whatever. And when my children were growing up, my son started out at the Baldwin fast food store over on you know, Baldwin Road, and you know, the new one is there now. And when my son was there, you know, it was the 15, 16, and 17-year-olds, and then somebody was the manager that was running the place, okay? Well, today you got the 15, 16, and 17-year-olds, you got the 25, the 35, and 45-year-old, and you have the senior citizen that I am also there. That is telling me that we have a problem, and it's also telling me that that's why we need to take care of the health care, and those people do not have health care. And they're making that money that you mentioned, that $11,000, $12,000 a year as a single, and they won't be covered. Now, obviously, some of those will be covered under their parents until they're the age of 27, 26, 27. But those that are in between that gap, it needs, and we need to help them. And the good part about this is that there's an off-ramp. We put an off-ramp. If your income goes up, we got a way to get off of this. You know, you just don't stay there forever, you know. So these are the things that we spent a considerable amount of time this summer on. I'm very proud of the reforms that were put in there, and now it's due diligent to make sure that we get these reforms enacted properly by November of this year.
Okay. Well, I want to thank very much State Senator Jim Marleau from the Orion area here, and David Roy, representing the Small Business Association of Michigan, for being with us today to give us more information about this expansion of the Medicaid program and how it has benefit for not only the low-income person, but for every citizen across the state of Michigan. Gentlemen, thank you very much for being here.
Thank you.
Thank you all for watching this,
Thanks for coming across the state.
you know, information in the public interest.